And here's Dr. Benji.
On today's show, it's kind of touching my heart. We're going to go over glycolypic disorders. And this one really hits home because just a few months ago, I lost my niece to Gaucher disease. It's very heartbreaking. This is her picture right after her first year birthday. Little Braylon right here. So we're going to talk a little bit about glycolypics. It's are carbohydrates that are attached to a lipid, whose main role is to provide energy and function as markers for cell recognition. Disease has three types of diseases. Braylon here, however, was diagnosed with type 2 Gaucher disease, which is reason why she died before she reached the age of 2. It took her life right after her first birthday, as I stated earlier. She suffered brain damage and seizures from enzyme deficiency. Braylon went through enzyme replacement therapy. It's a procedure that gives patients a dose of enzymes every 2 weeks to boost their glucose levels. So on today's show, we have 3 special guests who have been going through some type difficult situations, who have dealt with glycolypic disorders. Our first guest is Lucille.
Let's talk about this.
So, like I said, we have a special guest. Her name is Lucille. She will be talking to you all about the different diseases that her child went through. So, Lucille, please introduce yourself.
Well, I'm Lucy, and I have 2 daughters, my beautiful daughters, Madison and Elizabeth. And as you can see, Elizabeth is the one who had the disease. Her disease was Tay-Sachs disease, which is a glycolipid disorder, which is what we're talking about today. And some of the symptoms from her disorder was that her motor skills were weakened, or they didn't develop properly. And she suffered from seizures. And you can see that she has a feeding tube. She had trouble eating. And so, yeah, that's some of the symptoms. We had a hard time with her sleeping because she was going through so much pain, and it was.
When you took Madison to the doctors, did they have any treatments or anything?
Well, he mentioned the enzyme replacement therapy, and that's where they give you like enzymes to help build up your glucose levels. And that didn't help well because shortly after she started receiving these treatments, she passed. So, and it's been over a year since she passed, and it was hard dealing with it.
So is this hereditary, or?
It is. We learned that it's an X-linked trait, which means that the gene is on the X chromosome. Her father had it, and I have the gene also. And so she was, unfortunately, our daughter who got the disease.
That's very sad story. Are you guys working on having any more children, or just?
No, we're fine with just Madison.
Okay. Well, guests, let's give her a round of applause. And coming up next, we will have Miss Charlene to talk about her.
Let's talk about this.
Welcome back, guests. Sitting here is Miss Charlene.
Hi.
So please introduce yourself and tell us where you're from and about your son.
Hi, I'm Charlene. I'm from Atlanta, Georgia. And this is a picture of my son, Cadence, after birth. He was diagnosed with a glycolipid disorder, sialidosis. It's actually a deficiency in the alpha-N acetyl-neuraminidase, and basically that's the that's the enzyme that breaks down the large sugar chain within the body. And without that breakdown within the body, it severely affects the motor skills and physical development. And the form that he had was congenital, which was, in the womb. And when he was born, he had water on his brain, hydrocephalus. Also, a lot of the young children that are born, they have fluid in different parts of their body. He just happened to have it in his head, so he didn't really make it. He was alive for about 2 weeks, and that was his prognosis.
How early on would you say that they caught the disease?
It was diagnosed within when he was in the womb, so I'd say maybe about three months pregnant. I think I found out. So yeah, it was really disappointing.
Was there anything they could do to treat?
Because it happened in while he was in the womb and everything. Really wasn't because the progressiveness of the disease was really quick. Instead of actually him being born and they catching it at maybe 2 or 3 years old, so really wasn't much they could do.
Now, do you have any other children that are diagnosed with any glycolypic
No,
disorder?
actually, he was the only one. I don't think we're gonna try again. It was really hard, so I don't think we're gonna try again. We may adopt.
So do any of your family members have it, or is this the first time you're seeing this occur?
It was the first time, but a lot of my family, they don't really believe in gene therapy or anything. So I guess with us being, me and my husband being like kind of new age, we decided to go ahead and try to check it out and see exactly what's going to happen or what was going to happen. So
And that's good. That's good. You can tell your relatives who are planning to have children or friends to always to check that out. That's a good thing.
definitely.
So let's give our guests a round of applause. Thank you for coming out and speaking. We will have one more guest when we return, so stay in your seats.
Gee, let's talk about this.
Welcome back, guests. Today we have another special guest. Her name is Tiara Carter. She's a very special friend of mine. Last time I talked to her, she was pregnant with little Mackenzie. And so she's going to be telling us about the disease that Mackenzie has. So, Ms. Tiara, could you please introduce yourself and let us know what's going on today in your life?
Well, I'm Tiara Carter, as she said. I've known Talia for a while. Which is why when I found out Mackenzie had this disease, gangliosidosis, I called her because I know her niece went through a similar type of disorder. But gangliosidosis is a lysosomal storage disorder and basically a glycolypic disorder, which is what we're talking about. It's very rare, and it is also inherited like all the others that was talked about today. It affects the nervous system. It originates from the shortage of an enzyme called hexoaminidase. It's a buildup of ganglioside, and that causes a neurologic weakening.
Was there any other symptoms that Mackenzie went through?
Well, Mackenzie was 18 months before we actually started seeing signs, and some things was loss of vision, because of course, they start focusing on things, and it was like I would speak and she would look around like she didn't know where I was coming from. Right. So that was one thing. Also, she had enlarged gums, enlarged spleen and liver, and also loud noises. She would really freak out, if I can say on the air. She would really panic, basically, and become startled. And she definitely had muscle spasms, uncontrollably, basically. She would play with toys and end up unintentionally smacking it across the room because of the muscle spasms.
And how old was she?
18 months. Wait. It was like I would speak and she would look around like she didn't know where I was coming from. Right. So that was one thing. Also, she had enlarged gums, enlarged spleen and liver, and also loud noises. She would really freak out, if I can say on the air. She would really panic, basically, and become startled. And she definitely had muscle spasms, uncontrollably, basically. She would play with toys and end up unintentionally
So
smacked
does
me.
anyone else in your family have gangliosidosis?
Actually no. Mackenzie was the first person in our family that actually had gangliosidosis. But I did know that I was a carrier.
And you still had your baby.
I mean, I really wanted a child. I wanted children, so I did go in with that risk. Of course, I didn't want this to be the result. There are 3 forms of it. There's infantile, juvenile onset, and adult. Mackenzie would be considered juvenile because she was 18 months. Infantile is, they start seeing symptoms when they're actually a month old. So, yeah.
Well, I thank you for coming out. Audience, can we give her a round of applause? Thank you. I hope you all enjoyed the show. If you have any concerns or would like to donate to our fund, our children's fund, you can visit our website at www.thedenchishow.com.
Let's talk